Thank you very much, and I'd like to welcome the Minister to the House. And I want to really commend Senator Batchick and the Labour Party for bringing forward this legislation. I always go on, everybody in the House is tired of hearing me talking about the Women's Workers' Union winning the 2 weeks holiday for everybody and the importance of that. But I think it is really important because at the same time, the Women's Workers' Union was founded by many of the women who came out of that first revolutionary early part of the state, the founding state. And Margaret Skinner, of course, who came out of that same movement, played such a key role in the establishment of the INTO. And I want to acknowledge their role in pressing forward and pushing these issues on the agenda. And Senator Batchick has followed in that same tradition of looking to gender equality issues and looking at worker equality issues and how they are brought together. And I do want to acknowledge, because in this last, in the last Oireachtas as well as this one, she brought forward, I think, really important legislation in terms of platform workers, in terms of collective bargaining, and we still need a right to collective bargaining in this country, in relation to the JLCs and joint labour committees, recognising particularly sectors where women are often working, which needed collective bargaining rights and better rights, and of course in leading a lot of the work which has now been taken on very widely, I'm glad to see, in relation to the gender pay gap. And I think those are all pieces that fit together that idea that we recognise that people who are workers are also people, and that they have lives, and that they have, bodies, and that they have needs, and that's something I think really came strongly from the Citizen Assembly, the really incredible recommendations we've seen from the Citizen Assembly when they spoke about reconfiguring the Constitution. So it recognises, the private and family life of all families, not just married families, but also women who are parenting alone, or every kind of family that might be constructed in Ireland. And they also recognised that people may be both working and caring and balancing those concerns. And I think that is that vision of an integrated, honest discussion that we would have about life. And I have to agree with, there has been a culture of silence on the issues. There has been a culture of silence and a culture of secrecy and of stigma and of shame, and that is the reality. And it's not for no reason, and we have to be very clear, the Eighth Amendment played a key role in that. There are parts in the world, in El Salvador, in certain states, in the United States, where you can go to prison for having a miscarriage. That's the reality still. There is that concern where you have that, and it was a concern when people were afraid to talk about these issues. I was really struck by what Senator O'Reilly said about a lot of people won't speak to their doctor. Because for a lot of time, people were afraid to talk about these issues to their doctor. That has huge consequences in relation to miscarriage. For example, if it is an early miscarriage, if somebody is rhesus negative, that fact of being pregnant for however brief a period can have a huge impact on the viability of their next pregnancy, unless they're able to discuss it and learn about getting the treatment they might need or the additional care. That's why these issues are really important, and one of the things the bill does is not just helping the individuals who are affected, but shifting the culture in society where we recognise miscarriage as a very real, very hard thing. And in relation to the question of, the natural miscarriage versus the induced miscarriage, let's be clear, there's many kinds of miscarriage, and miscarriages can be both natural and then be induced. Miscarriage is not always a moment. I know it is when we see it in movies, which is one of the only places we tend to see it sometimes, is it is the terrible and awful moment. But a lot of people discover that they have miscarried when they go in for the 9-week scan or the 12-week scan, and they're excited. They're probably, unfortunately, at the moment alone because of the rules we have in terms of access in maternity hospitals at the moment. And they discover, no, actually, your pregnancy has ended, but your body doesn't realise it yet. And that might last a week. You might walk for a week or 10 days around looking pregnant, but not being pregnant. That's sometimes how long a miscarriage will take, and it may require medical inducement, and it may require surgical intervention. That's all part of some people's miscarriage journey, and that gives us the sense of why we're not just talking about time to grieve. Sometimes those 20 days will be needed for the process itself. This is really, really important in terms of how we move things forward. And the IVF piece, which has been talked about, the assisted human reproduction legislation must come through. And you've heard, I hope, Minister, from others, the demand that we have equity at the heart of that. That we look to ensure that we don't just deal with the technical and the moral issues of assisted human reproduction, but with those issues of equality of access, and that's going to be really important. And this, again, is an important piece that recognises the times and dates are non-negotiable. They're very specific moments that people have. They're days that they have in relation to things. And I want to just commend a really important part of this bill: the protection of employment rights. It is vitally important that persons who are pregnant, who have a miscarriage, or who have to attend IVF appointments do not feel that they are going to be jeopardised, sidelined, mistreated, disconsidered for promotion, placed into other roles. We shouldn't have a culture where people, are afraid to talk about the fact that they maybe want to have a child in their workplace. And there should be no and there's a reason why we have protections in relation to pregnancy. Similarly, we should have protections in relation to your employer not disadvantaging. And that's why this is not just a health piece. This is a workers' rights piece of legislation, and I just strongly commend it to the House.